Good afternoon, everyone. I mean, I think we're all obligated to say "Go Birds," okay? I think we're, at the front end of every conversation should be that phrase. I'm State Senator Vincent Hughes. Thank you so much for being with us today, January 27th, 2025, where we're re-engaging, if you will, on a fight, Matt, that I thought we had won a long time ago, all right? And we did win it a long time ago. But it is clear, it's important, it's necessary to make sure that we keep fighting because the issue is that important. We're talking about health insurance for millions of Pennsylvania citizens. We're gathered here because we take the threats seriously. We take the allegations seriously, we take the assertions seriously, and we take Project 2025 seriously as well. In 2025, they discuss eliminating all of the provisions that were provided to us in the Affordable Care Act. We are here to make sure that those provisions are passed at the state level so that they're enshrined at the state level so that Pennsylvania citizens do not have to worry about health insurance in the Commonwealth of Pennsylvania ever again. Now, my colleagues will speak to the specifics of these provisions, but they're embodied in 4 bills. Senate Bill 50, pre-existing medical conditions, which passed the House in the last term. Senate Bill 51, essential benefits, which did not unfortunately pass the House in the last term. Senate Bill 52, no lifetime limits, which did pass the House in the last term. And Senate Bill 53, which allows a young adult to stay on their parents' health plan until the age of 26, which did pass the House in the most recent term. Those are the 4 provisions, foundation provisions for all health insurance carriers and for all citizens of the Commonwealth of Pennsylvania that are core to Obamacare, are core to the Affordable Care Act, are why we are gathered here. And of course, we have to thank the House of Representatives for passing those initiatives. And of course, if they have it again, they'll pass them again. The problem remains on our side of the building, but we'll talk about that going forward. We're here fighting for the people of Pennsylvania in a fight they need someone to stand up for, because each and every provision in Washington, D.C., and the statements by the individuals responsible to administer the health of the people of this country, especially the health of people in Pennsylvania, have already been discussed about removing all of these provisions. And we can't stand for that. And we're fighting to protect Pennsylvania's people. I'm going to ask the president of SEIU Healthcare, Matt Yarnell, to come forward right now. Matt, again, here we are one more time, but that's okay. It's the right fight, it's the good fight, and we thank SEIU for standing in partnership with us.
So good afternoon, everybody. I would normally say I'm proud to be here, but more shaken and frustrated that we are here again. As the senator said, we've been on this fight and thought we won this fight, and here we are again. I'm Matt Yarnell, president of SEIU Healthcare Pennsylvania. We bring together tens of thousands of healthcare workers from all of the healthcare sectors across the Commonwealth. I want to take a second to shout out and recognize some SEIU folks who are also here today. Steve Katniss is the president of Local 668, and his secretary treasurer Nina Coffrey is here, as well as some SEIU home care members are here here today as well. Just a little bit, SEIU healthcare members worked for decades to pass reforms to healthcare that were out there to provide higher quality healthcare for everyone in our country. SEIU registered nurses, doctors, and other healthcare workers took the lead on promoting the Affordable Care Act and educating our communities about the ACA's benefits. We've also fought to protect the law against this extremist agenda that would have left millions without coverage, and here we are again. We care about the Affordable Care Act because we want to see our patients and the communities that they are part of healthy. We also care about our members who aren't just healthcare workers, but they are also healthcare consumers that have benefited from the protections of the ACA. Also, home care workers, I want to spend a moment on, aren't able to get employer-based health care. And so those home care workers who are making sure people can live and age and be cared for in their homes with dignity rely on the ACA to be able to get health care coverage themselves. And so we are going to stand up and fight to make sure that the ACA is not rolled back, which is the absolute plan of the Republicans and the Trump administration in D.C. Let me just say about the fight we've been in over the years to protect the ACA. We've gone through 2 Supreme Court cases and over 50 votes that were held by the Republican Congress to repeal the law. And we have beat those back, and we're going to continue to fight to make sure that we beat those back in the future. And to what Senator Hughes said, we take very real the threats and the seriousness of this administration's focus to rip away health care from millions of people across this country. I'm happy to join with the Senate and House Democrats, especially Chairman Hughes, in supporting this bill package to protect the Affordable Care Act. In the second era of Donald Trump and the Republicans in Congress, we want to make sure we send a message that the Affordable Care Act and programs like Medicaid, which we know is on the chopping block, are going to be here and here for working Pennsylvanians. We are also, as a healthcare union, going to do everything we possibly can to stand up to billionaires and millionaires who want to fund their tax cuts permanently by stripping away health care from Pennsylvanians and folks around this country. We're not going to stand for that, are we? No. We're going to do everything we can to support these bills to make sure that the Senate can get them through and the House can get them through. We appreciate your leadership. And if there's ever a fight around health insurance, we are going to be in it. Our members are going to be in it across this Commonwealth, and we look forward to doing everything we can to support you, Senator, and the leaders in the House to get this done. Appreciate it. Thanks.
Thank you very much. Oops. Thank you, Matt. Joining us right now, as I said, the House has been stalwart in this issue area for a long time. We've worked in partnership over many years to advance this agenda, to secure these rights, secure the support, and to make sure it's protected. The whip for the House of Representatives, Representative Mike Schlossberg. Mike? Thank you, sir.
Thank you, Chairman. Go Birds.
Yes.
I feel like it's a legal obligation for the next 2 weeks. You have to begin and end every press conference. I want to take a second before we really get into the meat of why we're here to zoom out, because like my colleagues up here, I've received countless calls from deeply concerned citizens and constituents who are worried about what Trump 2.0 will bring. We've already now made it through the first week or so, and we've already seen the chaos that he's wrought. But we haven't seen the start of his legislative efforts to really damage the people of the Commonwealth of Pennsylvania that those of us up here are lucky enough to represent. We know what will happen if his rumored efforts to repeal the Affordable Care Act are successful. We know that millions of Pennsylvanians will be sicker. We know that millions will be forced into medical debt. And we know that people across the United States will live more difficult lives. There are absolutely ways that we can enhance and expand access to health care, and that's what we need to be doing. Now, I mention this not only to talk about the Affordable Care Act, but to talk about a broader point. When people ask, what are you doing to fight back against the worst of the Trump administration? A huge part of that answer is going to come from the states. That's the new reality that we live in. Now, fortunately, in their wisdom, voters elected to return a majority of Democrats to the Pennsylvania House of Representatives, and we take that charge very, very seriously. And we will lead, as we did last year, by keeping our constituents in mind. Unfortunately, we can't say the same about our dear friends in the Senate, who I know have fought valiantly to protect the people that they represent. But with what we have, House Democrats are absolutely committed to making sure that we protect people's rights to health care. That means, fundamentally, protecting access to health care, regardless of any pre-existing condition you may have. That means making sure that we continue to end lifetime limits on insurance so that we know that people can get the protection and the health care that they need. And that means keeping adult children covered so that anybody up until the age of 26 can stay on their parents' insurance. We are no longer talking about the abstract. Project 2025 is no longer a big, thick, goofy book that people would parade around and say, imagine if they enacted these crazy ideas. Folks, this is real. What we are facing right now is real. It is a genuine assault on the healthcare rights of Pennsylvanians. And every one of us up here and plenty of people throughout this chamber are absolutely dedicated to making sure that we protect people's rights to get the healthcare that they need. Thank you very much.
Thank you, Mike. Representative Schlossberg said it very clearly. It is up to the states right now to do whatever they can, state by state, to protect the people that they represent. We can push back on the cuts that are likely to come from Washington, D.C. here in Pennsylvania. But we have to do it aggressively, thoughtfully, and we cannot lose health insurance coverage for millions of people in Pennsylvania who've already had it and now see it snatched away. To speak more clearly about this, please welcome Senator Maria Collette. Maria?
Thank you, Senator Hughes. There we go. Thank you, Senator Hughes. For those of you that don't know me, my name is Maria Collette, and I serve as the state senator for Pennsylvania's 12th district in Montgomery County. And I am also a proud registered nurse and worked in home care, so I understand the issues that Matt Yarnell was speaking about. Throughout my entire nursing career, I saw how the impact of the Affordable Care Act truly saved lives for families, our neighbors, and our patients. Before the ACA was implemented, many patients struggled to afford the care they needed while keeping the lights on and food on the table. That should never be the choice anyone is forced to make, and thanks to the Affordable Care Act, many Americans can find quality coverage at reasonable prices. Here in Pennsylvania, our legislature established Penny under the ACA to make prices even more competitive, lowering premiums by an additional 5 to 10%. But for years, extreme Republicans, including the current president, have threatened to repeal the ACA with no alternative plan to deliver affordable health care to our communities. In fact, this new administration has already issued a sweeping executive order targeting the Affordable Care Act and the 24 million Americans who will be negatively impacted by that decision. If this administration continues down this path, let me paint you a picture of what our country and our Commonwealth would look like without the ACA. You heard some of this, but it bears repeating. More than 100 million Americans with pre-existing conditions, including as many as 5.2 million Pennsylvanians, could be denied coverage or charged thousands of dollars more. Prescription drug prices would skyrocket for tens of millions of older adults. Young adults would be kicked off their parents' insurance. Even more of our rural hospitals could close without continued Medicaid expansion. We'd see the return of annual and lifetime limits, something my family worries about since my husband's diagnosis of chronic leukemia that thankfully can be treated, but only with incredibly costly medications. And the list goes on and on. It's impossible to overstate what a difference the Affordable Care Act has made in people's lives, or how important it is that the ACA remain in place. That's why we're here fighting back. For several sessions, my Senate Democratic colleagues and I have introduced a package of bills aimed at securing the protections of the ACA in state law, even as some in Washington attempt to strip them away. This session will be no exception for us. We understand the importance of leadership and majorities. We see that right here in Harrisburg with our allies in the House and the leadership of Speaker McClinton and Leader Bradford, who have passed bills within this package. Yet year after year, Senate Republicans choose to take no action. It's long past time that our legislature unites in protecting the health care benefits that countless Pennsylvanians across every county depend on. Whether my Republican colleagues choose to work with us to serve all Pennsylvanians by passing these bills or decide to prioritize special interests over their own constituents, that remains to be seen. But one thing that I can promise is that we will continue to fight to reduce costs and expand access to health care until it is the law of the land here in our Commonwealth. Thank you.
Again, let's be mindful about what it is that we're talking about here. We're talking about pre-existing medical conditions. We're talking about the essential benefits package. We're talking about the annual lifetime limits and ending that, making sure that that is no longer a thing that Pennsylvania residents have to deal with. And we're talking about coverage for young people, young adults on their parents' health insurance. These are important, these are foundational, these are fundamental to the health quality for people in Pennsylvania. To speak more about this, someone who just recently has been spending a lot of time burning up my phone up dealing with health care in Delaware County, Senator Tim Carney. Tim? You keep burning it up.
Thank you, Mr. Chairman. I'm Senator Tim Carney. I'm proud to stand here with my colleagues today as we take decisive action to protect the people of Pennsylvania from the uncertainty and harmful decisions that are being made at the federal level. With so much at stake, we cannot afford to wait or remain idle while access to affordable health care is under threat. We all know the Affordable Care Act has been a lifeline for so many. Here in Pennsylvania, we've seen record-breaking enrollment through our state marketplace, with nearly 500,000 individuals securing coverage this year alone. These families, students, and seniors deserve to know that their health care won't be suddenly out of reach because of reckless decisions that are being made in Washington. That's why I fully support the package of bills that we're introducing. These measures will ensure pre-existing conditions remain covered, that lifetime limits on care are prohibited, and that essential health benefits like maternity care, mental health treatment, and preventive services are all protected in Pennsylvania. This isn't about politics. This is about people. It's about the mom who can get a cancer screening and doesn't have to stress over getting that treatment or paying to put food on the table. It's about the young adult who can stay on their parents' insurance and the family that won't have to choose between paying for prescriptions or keeping the lights on. Americans are incredibly upset at the rate of coverage denial from health insurers, and Senate Bill 51 will ensure that every insurance plan covers the most basic essentials that every Pennsylvanian needs in health coverage. Trips to the emergency room, maternity care, ambulance trips, basic lab services, and prescriptions. It's outrageous that politicians in D.C. are considering taking these things away from Americans. We are here because we refuse to let Pennsylvanians lose the progress that we fought so hard to achieve. While Washington debates rolling back protection, we are building safeguards here in the Commonwealth to ensure affordable health care remains accessible to everyone. That's what leadership looks like, standing up for the hardworking people of the Commonwealth. Thank you.
Thank you. Thanks, Tim. Thank you very much. Thank you. Senator Carney touched on the list, but I want to walk through it a little bit more. Essential benefit package covered right now: hospitalization, ambulatory services, emergency services, maternity and newborn care, mental health and substance abuse treatment, prescription drugs, lab work, preventive care services, pediatric dental and vision care, rehabilitative and habilitative services. Those are all fundamental aspects of the Affordable Care Act passed in Washington that Pennsylvania citizens have right now, but they're being threatened as we speak. We must protect them in Pennsylvania. To speak to us right now, the chair of the House Insurance Committee, Representative Perry Warren. Perry.
Thank you, sir. Thank you, Senator. Protection of Affordable Care Act benefits are essential to the health and the economy of Pennsylvania. And Senators, thank you for including Majority Whip Schlossberg and me in this otherwise Senate press conference. We look forward to partnering with you Senate leaders in ensuring the continuation of ACA benefits, as we did last session under the leadership of then House Majority Insurance Chair now Senator Patty Kim, who will continue to champion ACA benefits in the Senate. Last year, the House, as Senator Hughes alluded to, passed lifetime limits, or prohibition of lifetime limits, passed required coverage for pre-existing conditions, and passed legislation requiring that children stay on their parents' insurance until age 26. The House also passed, and we will be reintroducing a fifth bill addressing specifics of preventive care, largely encompassed within the Senate Essential Health Benefits bill. We'll be moving forward with that as well as passing this time around a House version of the Essential Health Benefits bill. It's absolutely critical that we do this for our residents, for our future, for our economy, and for the health and safety of our residents. And we will, in the House side, work with our Senate leaders to make sure that happens for Pennsylvania in the wake of any changes at the federal level. Thank you, Senators.
Thank you. Appreciate you. Thank you. Are these your notes? And there's your poster, too. Oh, well, thank you. You have to hold your poster. All right. Very good. Joining us, Senator Amanda Cappelletti. Amanda, thank you for being here. Thank you. It was just mentioned that these matters got passed in the House of Representatives under the leadership of then Chair of the Insurance Committee, then Representative Patty Kim. Now she's a senator, and we want to welcome her to the microphone now, where we know she will keep up that fight. Senator Patty Kim. Patty?
Thank you, Senator Hughes. Again, my name is Patty Kim. I'm the senator for Dauphin County, Lower Dauphin County Part. I want to thank Senator Hughes for his leadership and for bringing us here together on such an important issue. I want to thank SEIU and their leadership for coming out here to support this cause. Folks, this is too important to sit on the sidelines. We as legislators have that title, lawmaker. We pass laws, but we have to add another title. We're the lookouts. We're the lookouts for whatever drops from Washington, D.C. Whatever crazy thing that happens, we will be on the lookout. What has been said may or may not happen, we don't know, but what we know is we're going to be on the lookout for our constituents. As mentioned before, I want to shout out to some of the staff members in the House Insurance Committee. Joe and Alan worked really hard. I said, we have 1 month left before the session ends. What should we work on? And they said, we need to do this because it's that important. So we passed it in the House, we can do it again in the House, and we can do it in the Senate because it's that important. ACA is working. It's saving lives, it's saving people money. Don't take it away, build on it. President Trump, please. We need to build on what's working. Thank you so much again, Senator Hughes, for your leadership.
Here's your poster again. Thank you, Senator Kim. And finally, joining us from Bucks County, Senator Steve Sanacero. Steve?
Thank you, Senator Hughes. Good afternoon, everyone. Senator Hughes, you began this press conference today by noting that didn't we already have this fight?
Yes. And didn't we already win?
And we had this fight, and we won it almost exactly 15 years ago. It was in March of 2010 that the United States Congress passed and then President Obama signed what then became known as Obamacare, or the Affordable Care Act. And I want to give a quick shout out to our friend from Bucks County, former Congressman, former Assistant Secretary of the Army, Patrick Murphy, who was one of those members of Congress in a tough seat who nonetheless put up the vote. And that was a critically important vote. And that's why we get sent to our respective legislatures, to put up the tough votes, to do what's right for the people whom we represent. And that's why we're here today. All of my colleagues very eloquently stated what is at stake for the people of the Commonwealth of Pennsylvania should the Trump administration move and the Congress agree to strip away the protections, the hard-fought protections that the Affordable Care Act has given each and every American. We can't let that happen. My bill, Senate Bill 53, is the bill that focuses on allowing young people to stay on their parents' health care until the age of 26. And look, we all know in the abstract why that's important, but let's think about it. Today, more than ever before, young people are struggling. They graduate high school, Some go on to college, some go into building trades, some go into other vocations, and they have a hard time just being able to put together the money to make ends meet. This idea of trying to buy a house, we know that attainable housing is a critical issue across the Commonwealth of Pennsylvania, something else that our legislature needs to act on. But then if you add on top of that, in those critical early years, the inability to have health care, the inability to be able to afford health care because now they're getting taken off their parents' plans before the age of 26, we are making it that much harder. We're tying both of their hands behind their back and saying, go ahead, try to make a bright future for yourselves. It does not work. So we here in Harrisburg have an obligation. We have an obligation to all of the people of Pennsylvania, regardless of where they live, whether they're Democrats, Republicans, or independents, whether they're just not involved in the political discussion at all. They need to understand that we are standing up for them. And in particular, we're standing up for young people to make sure they can get that strong start and have a bright future. So I want to again thank all my colleagues, thank SEIU for your leadership as well. Let's get this done. Thank you.
Thank you, Steve. Thanks for all of the senators and House members who've joined us today. We've got a lot of things going on. Thanks to our great friends in SEIU for always being there at the beck and call, especially in the healthcare space. Always been able to count on you in the healthcare conversation. And we remember the Medicaid expansion fight and how significant that was to finally get that done in Pennsylvania. We are here, and I see Representative Almond Brown has just joined us. Thank you, Representative. Good to see you, sir. We are here to say very simply that the health care of the people of Pennsylvania matters. And that those things that we fought so hard for, that are now currently the law, but are under threat, and under attack by folks in Washington, D.C., that we have a response. Don't do that. But if you're wrong-headed enough, and you do make those changes, and you do cut those benefits, we will make sure that they're secured here in Pennsylvania. We want pre-existing coverage, pre-existing condition coverage. We want an essential benefits package to remain in Pennsylvania. We want to make sure that the lifetime limits does not happen in Pennsylvania. We want to make sure that every young person can stay on their parents' health insurance package until the age of 26. That is what we are fighting for. That is what we're working for. We see the attack coming. We know the playbook, but we also know that we have the opportunity here in Pennsylvania to make sure that we protect and, in fact, advance the health of the people of the Commonwealth of Pennsylvania. We will not fold. We will keep pushing forward. Thank you all very much. Thank you. Thank you.
Great job.
Thank you.
Thank you so much.